physios, I welcome you all to our channel Physiotherapy. We are back with our next lecture on shoulder complex biomechanics, and today our topic of discussion is the scapulothoracic joint. So in our this series of shoulder complex biomechanics, till now we have studied about sternoclavicular joint and acromioclavicular joint, and now we are going to start the scapulothoracic joint. Okay, so this is very important to understand, and let's get started. So as the name suggests that this joint will be between the scapula and thorax. Okay, scapula is setting at our thorax, but do you think there is any bony connection or a fibrous connection between the scapula and thorax? Okay, so at my back, okay, there is scapula which is sitting on the thorax, but there is no bony or fibrous connection between the scapula and thorax, and due to this reason we refer this joint to be a true functional joint. It is a true functional joint but not a anatomical joint. Why not an anatomical joint? Because of lack of any fibrous or bony connection. So you will wonder that how this particular bone is like placed at our thorax. So you know that there are muscle around the scapula which are maintaining its integrity. Also the integrity of the scapula on thorax is maintained by two joints which we have studied already. The first one is sternoclavicular joint, this is sternum, and second is the acromioclavicular joint. So these two joints are helping to maintain the integrity of scapula. So we can write that the integrity of scapulothoracic joint is by the AC joint, that is acromioclavicular joint, and also due to the sternoclavicular joint. So like this they are holding the scapula. So here is the sternum and this is the sternoclavicular joint, and this one is AC joint, acromioclavicular, and like this the scapula is placed on thorax, and due to this unique presentation or the integrity, it is called a true closed chain. So these three joints behave as a true closed chain. Okay, that is the movement that occur in scapulothoracic joint. Definitely it is contributed by the sternoclavicular and the acromioclavicular joint. Okay, so till now what we have studied, that scapulothoracic joint is not a true joint, that is not a true anatomical joint, and it is a true functional joint. Okay, how the position is maintained? It is by AC and SC joint, and it behave as a closed chain. Okay, there is no fibrous connection, fibrous or ligamentous connection between the scapula and thorax. Okay, so this is about the general introduction to the scapulothoracic joint, and now we will move toward the resting position of scapula. The resting position of scapula, I will just explain that how the scapula is oriented on our back, that is on our thorax. Let me make vertebral column like this. Okay, this is just a diagram. Okay, let us say this is our vertebral column. So now you need to learn it step by step. The scapula is placed 5 centimeter away from the vertebra. First point. So first point is it is placed 5 centimeter away from the vertebral column. Second point, it extends from second 5, 6, 7. Second to the 7th vertebra level. So this is the second point. Okay, first point is that the scapula is placed 5 centimeter away from the vertebral column. Second point, it extends from the second to seventh vertebra. Which one? The thoracic vertebra. Now I will make you understand three different angles, okay, that are important to learn the orientation of scapula. If we see from the posterior side, okay, the scapula is, so let me just make this diagram, that is a hypothetical condition, and here the scapula is making an angle. This angle is 5 to 10 degree. That is, the scapula is 5 to 10 degree upward rotated. Okay, it is 5 to 10 degree upward rotated. Okay, upward rotated when we see it from the posterior side. Okay, so if this is my scapula, this is vertebral column. Scapula is placed 5 centimeter away from vertebral column. It extends from second to the 7th vertebra. Also, if you will see it from posterior side, it is 5 to 10 degree upward rotated. So let us look it like this. Okay, I will place it like this. I have made diagram of opposite side. Okay, so this is the vertebral column and this is the scapula. It is 5 centimeter away, extended from 2 to 7th thoracic vertebra and 5 to 10 degree upward rotated. Now, if we see it from side, it is not vertical. It is slightly anterior tilted, and that tilt is 10 to 20 degree. 10 to 20 degree. So from the vertical, the scapula is 10 to 20 degree anteriorly tilted or anteriorly tipping. Okay, so this was third and this was fourth point. Last point is when we see it from the superior part. Okay, so let us say this one is our frontal plane or coronal plane. We are watching it from top. Okay, from top like this. It is not present in accordance with the frontal plane. It is slightly angulated, and that angulation is 30 to 45 degree, or in some books it is written as 35 to 45 degree. So this one is fifth point. This one is fifth point. So here it was 5 to 10 degree upward rotated. Here it is 10 to 20 degree anteriorly tipped, and here it is 30 to 35 degree. What it is movement? It is internally rotated. And let me now explain it with the help of this marker and scapula. It is present 5 centimeter away from vertebral column and extend from second to 7th thoracic vertebra, 5 to 10 degree upward rotated. Okay, and if we see it from side, it is slightly anteriorly tilted, that is 10 to 20 degree, and if we see it from top view, it is 30 to 35 degree internally rotated. And now you can see it has become like this, so that it can be placed conveniently and in congruency with the thorax. Okay, so this is whole about the resting position. So there are total 5 points. 5 centimeter away, second to 7th vertebra, 5 to 10 degree upward rotated, 10 to 20 degree anterior tipping, and 30 to 35 degree internally rotated. It is internally rotated to be we can say maintain the proper congruence with the thorax. So this is about resting position. Now we will move toward the motions of the scapulothoracic joint. Under the motions of the scapulothoracic joint, we will cover 3 rotatory movements and 2 translatory movements. First of all, 3 rotatory movements. The first one is upward rotation and downward rotation. Okay. Second one is anterior tipping and posterior tipping. Third one is internal rotation and external rotation. Have you heard these three names before? You will have to say definitely yes. Where? Same as the acromioclavicular joint. So you can say that the motion of the scapulothoracic joint is same as the acromioclavicular joint. What are it? What are that movements? That are upward rotation and downward rotation, anterior tipping and posterior tipping, internal rotation and external rotation. But when I was here, I explained one point, that the integrity of the scapulothoracic joint is maintained by both sternoclavicular and acromioclavicular joint. So definitely these movements do not occur independently between scapula and thorax, but these movements occur as a result of movement of movement of sternoclavicular and acromioclavicular joint. Okay, so we can say that some movement will occur at sternoclavicular joint and some movement will occur at the acromioclavicular joint, that will make up the whole motion of scapulothoracic joint. Okay, so definitely I will write here sternoclavicular joint and acromioclavicular joint, and we will discuss that what movement are, we can say, joining to make the motion of scapulothoracic joint. Now, first movement is upward rotation and downward rotation. In the acromioclavicular joint, what we have studied? Upward rotation, downward rotation. In upward rotation, glenoid fossa move upward and inferior angle move laterally, while in downward rotation, glenoid fossa move downward and inferior angle move medially. Okay, and I have said that upward rotation and downward rotation are produced by sternoclavicular and acromioclavicular joint. Now, let me write sternoclavicular joint movement here. Sternoclavicular joint movements are elevation and depression. Okay, elevation and depression. Second, it was protraction and retraction, that is like this, protraction and retraction. And third was anterior rotation and the posterior rotation. Now, the motion of upward rotation and downward rotation of scapulothoracic joint is produced by some motion of sternoclavicular and some motion of acromioclavicular joint. And the motion of acromioclavicular joint and scapulothoracic joint are same, so I will write it as it is. So it is upward rotation or downward rotation. Here it is anterior tipping or posterior tipping, and here it is internal rotation and external rotation. But you need to understand that what movements of sternoclavicular joint is contributing toward the upward rotation and downward rotation, toward anterior and posterior tipping or tilting, and toward internal and external rotation. Now let's get started. Upward rotation, downward rotation. In upward rotation, glenoid fossa move upward, inferior angle move downward. In downward rotation, glenoid fossa move downward and inferior angle move medially. Now, you need to think that what motion of sternoclavicular joint will be involved here. Either it is protraction, retraction. No. Either it is elevation and depression. Yes. So, I will write here elevation and depression will be contributing for upward and downward rotation. Also anterior rotation and posterior rotation will be contributing. Why? Because slight opening of the acromioclavicular joint is important for rotatory movement, that is upward rotation and downward rotation. So you will say that for the upward rotation and downward rotation of scapulothoracic joint, acromioclavicular joint does upward rotation or downward rotation, and sternoclavicular joint will do these motions. And you will be surprised to know that from these two, this movement is 2/3 and this movement is 1/3, which means there is more contribution of anterior and posterior rotation toward upward rotation and downward rotation as compared to elevation and depression. Okay, so till now what you have studied, that for the upward rotation and downward rotation of scapulothoracic joint, Acromioclavicular joint does the same motion and sternoclavicular joint does these two movements. Now for anterior tipping and posterior tipping. Anterior tipping, posterior tipping. Anterior tipping, okay, so glenoid fossa move anteriorly and inferior angle move posteriorly. And for posterior tipping, the glenoid fossa move posteriorly and the inferior angle move anteriorly, okay. Now the second motion of the scapulothoracic joint is anterior tipping and posterior tipping. For anterior tipping and posterior tipping, definitely there will be some contribution of sternoclavicular and some contribution of acromioclavicular joint, and acromioclavicular joint will do the same motion, so it is sorted. And what is that movement? Anterior tipping, posterior tipping. In anterior tipping, acromioclavicular joint move anteriorly while inferior angle go posteriorly. While in posterior tipping, acromioclavicular joint move posteriorly and inferior angle move anteriorly. Now you need to understand or relate that which movement of the sternoclavicular joint will be used here. Either it is elevation depression, or it is protraction and retraction, or it is the rotatory motion. So from here, elevation and depression is the motion that is required, okay. Elevation and the depression is the movement that is required. Why? Because anterior tipping use some elevation while posterior tipping use some depression, okay. So the anterior and posterior tipping of scapulothoracic joint is due to sternoclavicular joint elevation and depression, and AC joint same motion. Last is internal rotation and external rotation. So here also some contribution will be from here and from some contribution will be from here, and here the motion is as it is, while in the sternoclavicular joint you can think which motion will be important for internal and external rotation. Now let us see what is internal rotation. In internal rotation, glenoid fossa move anteriorly and the medial border of the scapula move posteriorly. While in external rotation, glenoid fossa move posteriorly and the medial border move medially. So you need to understand that here sternoclavicular joint protraction and retraction is utilized, okay. Protraction and retraction is utilized, and this is whole about the rotatory motions. So in simple words, the rotatory motion of the scapulothoracic joint do not occur independently. They need motion of both the sternoclavicular and acromioclavicular joint, and acromioclavicular joint motion is as same as the scapulothoracic, so I have written it same. And here you need to just basic thinking to understand that which movement is required for these motions. Another important point that I want to add for the three rotatory movement is that the upward and downward rotation is referred to be the primary motion at the scapulothoracic joint, while anterior tipping and posterior tipping along with the internal and external rotation is the secondary motion. Why? Because upward rotation or downward rotation is the most visible motion of scapulothoracic joint. Next is the two translatory motions of the scapulothoracic joint, and that are elevation and depression, and second one is the protraction and retraction, okay. Protraction and retraction. In elevation, scapula move upward. In depression, scapula move downward. In protraction, scapula move laterally, and in retraction, scapula move medially. Is it as simple as I am explaining? No. Why? Because the shape of the thorax is not, we can say, flat. It is convex. So it need to move according to the shape of the thorax to maintain the integrity, okay. So I will make it just like that. Okay, so this is our thorax shape. Okay, and this one is scapula. Okay, this is scapula. So if it has to move here, or it has to move upward and downward. So upward is elevation and downward is retraction, okay, depression. Okay, and medial movement is retraction, and lateral movement is protraction. Now, what movements are used here during elevation and during depression? So you need to think that for all these movements thorax is convex. So whenever there is elevation, it is not pure elevation, it is some sort of anterior tipping, and when it is depression, it is not pure depression, it is some sort of posterior tipping, so that it, we can say, slide properly or maintain the integrity of the scapula over thorax. So I will explain you just like this. For elevation it move like this, for depression it move like this. So you can say that in elevation there is elevation and also anterior tipping, and in depression there is depression and posterior tipping. So I will write here elevation requires some sort of anterior tipping, depression requires some sort of posterior tipping. It is very simple. Here also protraction and retraction, definitely they will involve something. This is the thorax. If there is protraction, you can see there is some sort of internal rotation, and if it is retraction, you can see that there is some sort of external rotation. So for protraction there is internal rotation, for retraction there is external rotation. Why? Whole it is due to maintaining the integrity of scapula over thorax. And why? Because the thorax is not flat, it is, we can say, curved surface. Okay, curved surface. Also protraction and retraction is referred to be abduction or adduction movement. Okay, abduction or adduction, where protraction is abduction and retraction is adduction. Okay, and why we can say they cannot be, we can say, much strongly referred here as abduction or adduction? Because there is some sort of internal and external rotation occurring during that movement. So this is whole about the motion. Last is scapulothoracic joint stability. So it is a quite stable joint, though it do not have any anatomical connection, but there are a lot of muscles which are present around the scapula, so it provides the stability to scapula, and injuries are more or less common here. Okay, so it is, we can say, finished. Okay, so let me just recap what we have studied. Scapulothoracic joint, it is not an anatomical joint but a true functional joint. First point. Second point is that integrity of scapulothoracic is due to sternoclavicular and acromioclavicular. Third point is that they behave as a closed chain. Okay, they behave as a closed chain. Next is the resting position. The scapula is, I am talking about this scapula. It is 5 centimeter away. First point, it is extending from 2nd to 7th vertebra. Next point, third point is it is 5 to 10 degree upward rotated. Next point is it is 10 to 20 degree anteriorly tilted and 35 to 45 degree internally rotated. So it is the resting position of scapula. Next is the motion. There are 3 rotatory and 2 translatory movement. Okay, rotatory are upward rotation and downward rotation, anterior tipping, posterior tipping, internal rotation and external rotation. And as you know, these motion of scapulothoracic joint are contributed by sternoclavicular and acromioclavicular joint, and sternoclavicular joint have the same motion. So I wrote it as it is, but here you need some knowledge to understand that which motion of sternoclavicular joint is contributing for these motions. And last is the translatory motions, and that are very simple. Okay, for elevation there is anterior tipping, for depression there is posterior tipping, for abduction or the protraction there is internal rotation, for retraction there is some sort of external rotation. Why? To maintain the position of scapula with respect to thorax. And last was the scapulothoracic joint stability, which is much easier. So with this, we are completing the scapulothoracic joint. In our next lecture, we will move further. So till then, you keep on studying. Thank you to one and all.